Wow. Scary.
Scary statistics, but it's all on point. And that presentation is quite well researched, and you touch on every aspect of hepatitis. And I hope that our viewers listen very closely. Now, in support of the movement, the global movement for hepatitis B, or just say hepatitis because the most prevalent ones are hepatitis B and C. I want us to do something to show that apart from this press briefing, that we're in support of the World Health Organization's initiative to ensure that hepatitis B is eliminated by 2030. Remember they signed on 194 governments signed on during the 69th World Health Assembly in Switzerland, that hepatitis B and C must be eliminated, which brings us to the theme of hepatitis B hepatitis commemoration for this year. Eliminate hepatitis.
Yes.
Very simple. Eliminate hepatitis. It's just like kick out malaria or kick out polio. And all of that. It's simple, quite apt, that every organization can rally behind and do something to show that they are in support. So hashtag show your face. Let's show our face.
Right.
Hashtag showing our face that we're in support of the World Health Organization's initiative to kick out hepatitis from the world by 2030. So we've done our part.
Yeah.
Now, let's take our next step of conversation from the documentary that was just showcased. In Nigeria, the statistics are quite alarming.
Yeah.
And like you guys rightly heard, or like you rightly heard, hepatitis, especially hepatitis B, it's more deadly, it's more dangerous, it's more infectious than human immunoglobulin, HIV. It's more infectious than HIV. It kills at a more rapid state than HIV. Currently in Nigeria, 20 million people are infected with hepatitis B.
Wow.
20 million people. And 50,000 people die every year. 50,000 people die every year. This is the statistics for Nigeria. The world statistics, like you heard, 2 billion people currently infected. 15 to 25% of that 2 billion will die. 400 million chronically infected, meaning they are receiving treatment as we speak. Every minute, 2 people die from hepatitis B infection. So this is not a statistic that was picked from the floor. Concise survey data collected. So people need to be very, very careful. And it is on the increase because the awareness is low. That is why we are commemorating World Hepatitis Day. The purpose for the commemoration is to shave off or scale up the awareness. Scale it up. People don't know. People just know HIV. Scale it up so that people will know if hepatitis B and C, which are the most chronic, or the most contagious ones, has the same platform as HIV. Then we will not be telling you 2 billion people are infected, 400 million people chronically infected, 50,000 die every year in Nigeria, 20 million infected in Nigeria. We will not be giving that kind of statistics. So we're telling you it's reducing because the awareness is there.
But why is it that there's no much awareness? Is it because it does not get the support of the international body like HIV and AIDS gets?
There is support, but it is not a front burner issue like HIV, because HIV took the world by storm. And people were just whole villages, whole countries decimated. And it got everybody's attention. And another thing why it got everybody's attention is because it's sexually transmitted. I know anything to do with sex, everybody's on their toes. But they keep forgetting also that hepatitis B and C are also sexually transmitted.
Yes.
The exact same way that HIV is transmitted is the exact same way that hepatitis B and C are transmitted. Unprotected sexual intercourse, multiple partners, using unsterilized needles, unsterilized sharp instruments, healthcare workers who are not using their protective equipment, personal protective equipment are infected. Even people who work inmates with dangerous criminals or in asylums and all of that, they're infected. Even see this earring I'm wearing. If by chance I have hepatitis B and you borrow my earring, you can get it from that. You go to the barbing salon, you use a clipper that is not sterilized, you can get it from there. Look, see here in Abuja now, you have these malams that go around, you hear them with their scissors clicking, they are doing their pedicure, manicure. If you see those kind of people, take off, just run. This is how it is spread, and they do not know.
Mm-hmm.
They do not know. And then something else that bothers me is a lot of people think that hepatitis B vaccination or infection or screening is only for pregnant women. The government of Nigeria, and in fact the whole world, made it one of the mandatory tests for pregnant women so that they do not transmit it to their babies. That is one of the way you can transmit it, through unprotected sexual intercourse, having multiple partners from mother to child,
Okay.
using sharps, men having sex with men. These are all the routes of transmission. So when you go to the hospital as a pregnant woman, it is mandatory. Even if the nurses or the doctors do not tell you, have you done hepatitis B test? Tell them, please, can I do?
Is a cost implication?
It's not expensive. It's not as expensive as if you get the infection and then you need to treat yourself.
Yeah. Okay, now let's look at the signs and symptoms of this hepatitis for people who might not know. We're just talking hepatitis, and well, some people might not know they're even down with it. So let's just look at it in layman's terms. What are those things that can make you identify hepatitis?
The problem with it is it's actually non-specific. It's like having malaria. You have fever, you're feeling tired, there's aches and pains. Okay, the only, even for malaria, you may even have jaundice because of the high fever causing breakdown of cells in the liver. And then you have bilirubin release, and then the eyes start turning yellow. Some people even have that with acute severe malaria. But that is part of the signs and symptoms. You have jaundice. Then when you go to defecate, the stool may be clay colored, and then the urine may be dark colored. So these are some of the specific symptoms. But even as I said, you may have even all of this in some other illnesses like as common as malaria. So but the most important message I want people to get from this press release or briefing today or outing is that you should step into a reputable hospital. Ask to be screened. If they tell you the money is 2,000 naira, it's 500 naira, you do not have the money at that time, go back home, save the money. If you're going to buy a recharge card for 500 naira, divide it into two. Buy 400 naira, save 400 naira, buy 100 naira recharge card until you get the amount of money they ask you to come and pay in the hospital. Or look for a non-governmental organization that do the screening for free. They will do it for you for free. If you are negative, that you use speed and say, where can I take the vaccine? Because that has told you that you are free from hepatitis B at that point. Don't only ask to be screened for hepatitis B, ask to be screened for hepatitis C too. Why? Hepatitis C may even be more dangerous in quotes.
So the screening is quite different. B screening is different from
there
C.
There are different test strips to use to do that. Reagents to test. Hepatitis C may even be more dangerous than hepatitis B. Why? Because there is no vaccine for hepatitis C.
Wow.
But you have a vaccine for hepatitis B. So if you're negative hepatitis B, you take your 3 days of vaccine every month, depending on which pharmaceutical vaccines you're using, which company's vaccine you're using. But if you're positive hepatitis C, then you need to go do further tests. That you're positive does not mean they're going to start treating you immediately. They may just observe you because it may not be at the chronic stage. Observe you, lifestyle changes, tell you what and what to eat, give you some multivitamin like Livolin to help the liver cope, and then change your lifestyle and tell you what to eat and all of that. Okay, so but you need to go and get screened, take your vaccine if you're negative, and please avoid high risk behavior, especially high risk sexual behavior, especially sharing sharps, earrings. Even a mother that chews her meat, that is hepatitis B positive, chews her meat and gives it to her baby.
That's serious.
The virus is in the spit,
it's
in the tears, it's in the urine, it's in the fecal matter, it's in the blood, it's in the semen, but it's highest in the blood and in the semen. But it's still there in all of these other bodily fluids that I have mentioned. So mothers, when you don't chew your food and give it to your babies, don't. And then hepatitis B vaccine was introduced into Nigeria in 1999 or 2000. So all babies born before 1999, 2000 were not vaccinated. They're adults now. So if you were born before and your parents did not have the opportunity, you need to go get screened. If you're negative, they give you your 3 doses. If you're born after 99 to 2000 and your parents did not vaccinate you as a baby, because hepatitis B vaccine is part of the childhood immunization series of vaccines that we're giving. B at birth, and then the 2 remaining doses until it's done. Then there's a booster dose that can be given 15 years plus later. Because it confers immunity.
Now let's look at, aside from getting it through sexual intercourse and all of that, what are all the other ways of contacting hepatitis?
We just already mentioned it. Sexual intercourse is number 1, not just ordinary sexual intercourse, unprotected sexual intercourse. Then having sex with multiple partners, not being monogamous. Then you have mother-to-child transmission. A pregnant woman, giving it to her baby. It's even in the breast milk, but it's not as infectious as for HIV.
Okay.
But it's also in the breast milk. Mother giving it to the baby. In utero, you also have using sharps, sharing sharps, needles, knives, razor blade, clippers, earrings, using sharps.
Okay.
And then men having sex with men.
Yeah.
Okay.
And then, of course, healthcare workers, accidents in the hospital, and all of that. But the good thing about hepatitis B, like I keep saying, is the vaccine is there to prevent any
Okay.
infection if you take your 3 doses.
Are there specific areas where it's quite common aside this? Are there regions of the country that are more likely to be exposed to this?
Well, we do not want to start telling people it's more common in this part of the country, in
Okay.
the other part of the country. The message is, it is real.
Okay.
It is here with us. We have been talking like for 10 minutes. In those 10 minutes, how many people have died? How many minutes do you have in 10 minutes? 10. Every minute, 2 people die.
So what's
So-
the time frame
So
between
we have
infection
20 people
and
already dead
wow.
as we're speaking here. Okay? So the infection presents as mild, moderate, or severe. So
Okay.
mild, mild, acute, or severe.
Yeah.
Okay.
And then, of course, severe is chronic. When you have chronic hepatitis B, it means you're going to be on treatment for life.
Wow.
Just the same way people who have HIV are on treatment for life.
Yeah.
You even take some of the same antiretroviral that the people who have HIV take. So it's a very serious affair. Very serious affair.
Okay, can you throw more light on the other forms of hepatitis?
Well, the other forms of hepatitis are not as dangerous as
As
hepatitis B and C.
Okay.
That is why they do not get the same attention as hepatitis B and C.
Okay.
But hepatitis A, it's you get it through fecal oral route. That is what you eat. That's the way it's gotten.
Okay.
Yeah. And there's even a vaccine for that too.
Okay.
Yes.
Now, you mentioned that the fact that hepatitis is not on the front burner, that's a major problem.
Mm.
In Nigeria, what can be done? How do we push to ensure that it is on the front burner?
It's the same thing that the WHO said in the assembly. We need to prioritize our goals.
Goals, okay.
If hepatitis B is on the increase, what can be done in the next 13 years, which is the mark, which is the time frame that they have set for themselves? What can be done? Awareness, awareness, awareness. Diagnosis, diagnosis, diagnosis. Testing,
Early
testing. Universal vaccine. If it's possible to make the vaccines free of charge. Actually, they're supposed to be free of charge in the government hospitals.
Yeah.
Okay.
But people pay. And then they hijack the vaccines, take them to private places, and then they ask you for crazy monies to come and take the vaccine. So we need to, if it's the pharmaceutical companies that are supplying the vaccines should subsidize for Africa, and then the government should make it free of charge to the population or to the citizens. And then, if it's possible, which I know it is, the awareness should not be only on 28th of July.
Okay.
July,
Yeah.
It should be from 1st of January to 31st of December,
Mm.
every day in between. Every day in between.
Okay.
Everywhere you go. Just the same way you hear about HIV, ABC, abstain, be faithful, use your condom, go get tested, which is the diagnosis.
Mm.
We should have the same thing for hepatitis B and C, because they are more, or hepatitis is more virulent than HIV.
Okay, for schools, do you think schools could actually play a key role, and social NGOs also?
Schools have been doing fantastic actually, and NGOs
Okay.
have been doing supremely well. Because
Okay.
without NGOs, I don't even know where we'll be. I'm sure that for a lot of you would have even heard about hepatitis B or C from NGOs.
NGOs.
Mhm.
You hear them on TV. We're having a free screening at such a place. Come with your family. Come and get screened. If you're negative, you get the vaccine. And schools, school is somewhere that people go to, and you get them en masse.
Yeah.
So imagine going to a school of 2,000 students, and you set a goal. You say all of the schools in Abuja will go and screen all the students. We'll screen all the students, and that's going to be our project for this year. And then you need funding, of course, because without funding you cannot move. But you need to start something and let people key into it and do what they need to do for you.
Okay.
Yeah, schools and NGOs and CBOs, they've been doing great.
Okay. Now, still coming back to Nigeria, we know the attitude of the country towards health. We know it's not really very impressive. Now, would you suggest an economic model, for this particular problem, projecting the cost of viral hepatitis? Would that go a long way?
It will be fantastic, because the economic model will be, we have a budget specifically for hepatitis B and C.
Yeah.
And like I said earlier, funding is key. Without money, you cannot achieve much. Because imagine if you want to give hepatitis B vaccines for free, The cheapest hepatitis B vaccine that I know is 2,000 naira a dose.
Wow.
That's the cheapest one I know.
And you have to get 3 doses.
3 doses. That is 6,000 naira. In these hard times, when you're telling somebody about that, the person doesn't want to hear.
Yeah.
The cheapest screening I know is 500 naira
Yeah.
to screen a person. So by the time you think of 6,500 naira for a husband, his wife, and 4 kids,
Wow.
they'll just say, okay.
Let's
Hold
wait
it.
until it comes.
Exactly. So if we have an economic model with budgeted line items for hepatitis B and C awareness campaign, of course you're going to have t-shirts, you're going to have IEC materials, you're going to have, pay for the press, jingles, online mass media communication and everything that you need to do. And then of course you're going to procure the medical consumables to get the personnel to go out. The personnel are also going to be incentivized to be able to go out there and do the screening. You're going to buy the vaccines, you're going to buy the test strips, you're going to buy everything that you need to make sure that it works, because you cannot do it haphazardly.
Yeah.
It has to be concise from plan A to plan B and everything in between.
But how available are the vaccines?
Like this, they're very available, easily available. They're out there. They're out there. It's the awareness is not there. People will ask you. Okay, I remember even recently I met a young girl. She's in a secondary school here in Abuja. The moment I saw her, I knew something was not right with her. And then I gave a talk on health and
Okay,
hygiene.
there's a physical symptom you can actually look at.
For
and
people who are
tell-
chronically
tell.
ill.
Okay.
When you see them, you know they're ill.
Okay.
She looks chronically ill.
What are the telltale signs?
She looked wasted.
Okay.
She looked wasted.
Dead. Okay.
Her conjunctiva that is supposed to be clear white
Right,
was
okay.
like yellowish pale yellow.
Okay.
She's emaciated,
Wow.
So she when somebody's chronically ill, you can
You
tell
know,
because
yeah.
the person looks wasted. So I said to myself, there's something not too, healthy about this
Right.
girl. And when I finished my presentation, luckily for me, I sat beside her, and then she whispered to me that she has hepatitis B.
Wow.
And I said, what happened? She said, well, that she was ill and her mother took her for tests. They said malaria, they treated her for malaria, treated her for typhoid, brought her back home. She still didn't get better. And then somebody said, okay, why don't you go and do some other tests? They did HIV, did hepatitis B and C, and they found that it was hepatitis B. And she's
Wow.
been on medication for the past 5 years. And this young girl
Wow.
is just 16.
But how long would it take for you to recover? Someone like her for a case study now.
She can't recover. She's hepatitis B positive.
Oh.
Wow.
She's on treatment. She's on antiretrovirals.
She
Wow.
cannot
She cannot recover. 90% of adults from 18 and above,
Yeah.
90% of adults actually recover and get antibodies against hepatitis B.
Okay.
But 90% of infants and 50% of children become chronically ill
Oh.
when they are infected. So it's difficult.
That's
Wow.
really
It's
terrible. Yeah.
difficult. Yes.
Okay, now let's look at the health practitioners, their place in this. How do they identify this on hand? Because we just mentioned now that she was ill, she went to the hospital and she was treated for malaria.
Mm.
So in some cases, we know that it will happen. I mean, you don't get it, they don't get to identify it immediately.
Mm.
So what do they do, like, on hand?
You just have to be on your toes. When somebody comes in, especially if the person has been coming in with the same complaints, headache, fever, fatigue, abdominal cramps, nausea, vomiting, and you have treated for malaria, you have treated for typhoid,
Yeah.
you have asked all the relevant questions, and you're not getting the answers that you need.
Yeah.
The initiative, the onus should be on the health personnel to say, okay, why don't we do hepatitis B and C and HIV, even HIV, and then because at a point HIV was free, even in some places it's still free. The
Yeah.
screening
Yes.
is still free. Something like that should be done for hepatitis B. It's free screening at government hospitals and private hospitals if it's possible. Then of course people can pay for the vaccines. But at the government level, the vaccine should be free. But at private levels, the screening should be free, and then you can pay for the vaccines. But everything's all about money. These things are not given to you free of charge, and you need to recoup. Businesses are not, invented or established, not to make wealth. They are invented to create wealth and to
Yeah.
make wealth. Yeah.
All right. What would you suggest to the Ministry of Health and the Minister specifically as a way to push further awareness? Because we look at NACA specifically for AIDS.
Mm.
Can we have something
Mm.
specifically for hepatitis?
Honorable Minister, sir, I'm speaking to you directly. My name is Dr. Mrs. Bryma. If it is possible, and I'm sure it is, if you have the will, and if you I'm sure you understand the importance of this burden of viral hepatitis B and C in Nigeria, 20 million infected. That is an estimate, not the real picture, because WHO says 10% of every population at every time is thought to be hepatitis B positive or infected, and we're about 200 million and counting, if not more, in Nigeria. Can you please, sir, open up a desk and employ people just specifically, or deploy people from various departments to handle hepatitis B just the way NACA is handling HIV? If it were possible at all, maybe we'll have our own hepatitis B NACA, or hepatitis NACA, National Agency for Hepatitis. So it will be NAP, or National Agency for Hepatitis, and something else with the A, NAPA. So
just to ensure
NAHA, NAHA, National Agency for Hepatitis. NAHA, something like that. It will go a long way to meeting that 2030 goal that we're trying to, reach, to eliminate hepatitis from Nigeria. And I want it to be fantastic if Nigeria becomes the first country to eliminate hepatitis in the world. Just the way we were told that we're free of Ebola and everybody was jubilating. It would be fantastic if something like that can happen for hepatitis. So please, sir, look into it.
Wow. You've got final questions.
What would you say is a place of CSOs in all of this?
See, we just said it already. They're doing fantastic. Civil society organizations, community-based organizations, faith-based organizations, NGOs, they're doing fantastic. Without NGOs, people will not even know about hepatitis B or C, or that you can screen for free, or you can have cheap vaccines. People will not know. So I give them kudos. Keep it up. If you're an NGO and this year you're not doing anything about hepatitis B, it's not too late. You do not have to do anything. It doesn't have to be on the 28th of July. You can do it any time of the year. Yes. 28th of July is just to tell people that hepatitis B is still there, it's still on the increase. Please do something and help people who are not aware.
Is your organization doing anything?
Oh yes, you can trust us.
So what's your line of events?
Intensive rescue is always there to rescue. Free testing, vaccines, and awareness campaign. Yes.
Okay. All right, I want to say a big thank you to the president of Intensive Rescue Foundation International for joining in trying to rescue Nigerians from hepatitis. Like we've heard, it's quite even more dangerous than HIV and AIDS. Kills faster, and once you positive, it's for life, and so that tells you it's not something you want to be part of. So do the right thing, get tested early enough, get vaccinated if you're negative, and that's a sure way to save your life and the happiness of the family and the nation in general. I want to say a big thank you once again to the president of Intensive Rescue Foundation International, Dr. Jennifer Brymer. Thank you very much for doing justice.
Pleasure to be here.
All right, like she said, I'm supporting it.
Yeah.
So
Show your face.
show your
Hashtag
face.
show your face.
Show your face, and let's support and help everybody, especially those in the rural areas. Pass on the message so that we all can be safe and have a greater Nigeria for the future. Looking at 2030, the Sustainable Development Goals, we can make it happen.
Now,
right.
before we go, let me not cut you short. I was at a forum yesterday at the Federal Ministry of Water Resources, and that is one ministry they blew my mind. They are doing fantastic when it comes to communicable diseases like this. So I just wanted to say, keep it up. Federal Ministry of Water Resources. All
right, kudos. That's the kind of good news we love to hear, because it means you're contributing to the well-being of the nation. All right, we're going for a quick break. When we come back, New Day will definitely continue.